Hello, my name is Dr. Julia Lewis and I'm a consultant in addiction psychiatry, and I've been working with people that have alcohol-related brain damage for a number of years now. So I've been asked to kind of share with you probably the main points that I would want someone to be really aware of if they were working with people who have ARBD. The first thing I'd say is that always remember that something can be done about this, and because of that, the earlier it's picked up and the earlier some kind of intervention is put in place, the better. And the intervention is simple. We're not talking about some fancy drug treatment. We're not talking about some in-depth therapy that's going to take years and years. What we're talking about is helping someone to get off and stay off alcohol, and yes, let's acknowledge that that can be very difficult, and ensuring that they've got enough of this thing called thiamine in their diet. And we're actually not very good at directing our behaviour towards all those nice foods that are good and healthy for us and contain thiamine. When our minds are on other things because of dependency on alcohol, then we go for quick, easy food. But I'll tell you now, there's not a lot of thiamine in a Mars bar. So helping someone and supporting them to stay abstinent from alcohol and to make sure they're getting enough thiamine in their diet is fundamentally the most important thing that needs to be done for people with alcohol-related brain damage. So it needs to be considered as a potential diagnosis, and it needs to be picked up as early as possible. When I was doing my training as a doctor, which was a number of years ago, people with, and we talked about Korsakoffs on its own back then, people with Korsakoffs were virtually written off. Oh, you can't do much about it now, they may as well just drink themselves to death. We're understanding now that actually, from the point of view of all the different types of cognitive impairment that people can have, ARBD is the positive one, because you can do something about it to stop it getting worse and potentially to get it better. Okay, so that's the first thing. The other thing I'd be aware of is that within your support of someone who's got ARBD, remember, willpower, it ain't gonna work, okay? Where does your willpower live? Where is the seat of your willpower? And let's face it, willpower is the ability in the face of overwhelming triggers to act in an impulsive way. Willpower is how we say, no, hang on, there's a reason why I can't do this. Where does that live? It lives in the prefrontal cortex, that front part of your brain, that part of your brain that alcohol damages. Okay, so expecting someone with alcohol-related brain damage to be able to engage their willpower when they are faced with a trigger to drink is unrealistic. Okay, so people need other ways of making decisions about drinking. They need support at various different levels. There will be some people who have lost that ability to such a degree that actually we can use things like the Mental Capacity Act to keep them safe and keep them away from alcohol. There will be other people who just need other little cognitive tricks on how to maintain their willpower. And what are those ways you can help? How can you support people? There are some really, really simple things, okay? If someone can't remember something, and if someone is repeatedly asking you the same question over and over and over again, it is incredibly frustrating. And the temptation is always to go, well, I told you that half an hour ago. What did I say? They genuinely can't remember what you've told them. And what researchers have found is that if you keep trying to get them to guess, all they are doing is reinforcing the wrong answers in their brain. What you want them to do is reinforce the right answer. So as frustrating as it is, when somebody asks you that same question for about the 20th time in the morning, give them the answer for the 20th time. And think, are there other ways that you can reinforce that answer? What we know is the more sensory modalities that we use to convey information, the better. So maybe not just telling somebody something, but giving them a visual instruction about it. If it's about a direction, how do I get from A to B? Walk with them and point out to them different landmarks on that route, even if it's just how do I get from the day room back to my bedroom, my care home. There are little tricks of the trade that we can use, but we have to remember that trying to get somebody to guess repeatedly is not as helpful as we think it might be. So those are kind of my little tips for working with somebody that's got ARBD. But if you're ever feeling a bit all at sea with dealing with somebody and you're not sure what to do, then do contact your local treatment services, because they will be more than happy to give you a bit of advice and help.